Hi, I'm Dr. Lynn, and I'm a colorectal surgeon in Long Island, New York. I work out of 3 hospitals: Huntington Hospital, Northam Manhasset, and St. Francis Hospital in Roslyn.
Dr. O'Connor, how did you get into colorectal surgery?
I got into colorectal surgery, and it's funny, I get asked that question a lot because it's an area where you have both diagnostic ability, treatment ability, and you have the ability to have a big impact on preventative health. With the colonoscopies, screening for colon cancer, it's an option where you can really make an impact on a patient's health. There's an area where you're also doing treatment for colon cancer, diverticulitis, you have office procedures, so it really runs the gamut of one specific field where you can really help somebody. I also like it because there's not a lot of women in colorectal surgery, and it's a field that's very sensitive, and to be able to provide this type of care for women and men, but most specifically women, where there are not traditionally a lot of females in that field, it makes it a more comfortable environment for them to come.
Who do you think is the ideal patient? Like, who should reach out to you?
Really, anyone with any problems that have to do with their colon, their rectum, their anus, or any other kind of health problems. People with constipation, diarrhea, people who are 50 years of age or older who need screening colonoscopies, people who may have any symptoms that come up, such as rectal bleeding, changed bowel habits. Any type of issue that you have with your gastrointestinal tract is something that someone should reach out to me for. Any type of change in your bowel habit, those are the folks that need to come and see me.
Is there anything that people can do at home to prevent any issues down the road?
Absolutely. Maintaining a healthy lifestyle is one of the most important things that you can do. That includes working out regularly, exercising, eating right, as long as you're not sedentary, things in moderation, such as drinking. If you're going to do it in moderation, avoidance of smoking, avoidance of obesity. Those are some of the common triggers that we see in patients who are developing colorectal cancer. If you have a strong family history of a mother, a father, a first-degree relative with a colon cancer or even colon polyps, you should come in and be screened and seek out help.
Are you seeing anything specific that's on the rise right now?
In young patients, we're actually seeing a rise in diverticulitis, and that's a function of the fact that there's just not enough fiber in our diet. And patients are coming in more and more with that. Additionally, we are seeing a rise in colorectal cancer in younger patients. I don't know if it's statistically relevant at this time, but our practice has seen an increase in that. So if there's any problems, I encourage patients to come in, be seen, and be screened.
And how can people reach you?
People can reach me very easily on the website, that www.lynnoconnor.md.com. They can call my office. The one in Lake Success is 516-608-6848, and just ask for an appointment. I also have an office in Huntington, Long Island, which is 631-423-5070. You can even just Google Dr. Lynn O'Connor. You'll be able to find me.
And if I don't live in New York, can you still help me?
Absolutely. If you don't live in New York, I still have information on my website, and you'll be able to go to my website, get a lot of healthy tips on lifestyle, on working out, on eating, just living a very healthy life. There's tips for screening and for what types of signs and symptoms you should be looking for.
Great. Thank you.